Hi, everyone. Thank you for being here today. I'm Delora DeVore. I am filling in for Dr. Ruth Roberts, who is taking a well-deserved vacation this week. I am the program officer of the Holistic Health Coaching Program and a former mentor. And I'm very excited today to have Nathalie Lampas with me. This is kind of like old times. She and I worked together. I was her mentor as she went through the course, and then she just shined so well. We were like, Nathalie, would you like to be a mentor? So she is here with us, and I'm so excited to talk to her about her personal experience with elevated liver enzymes. We know it happens all the time, and we hope that this really helps a lot of people. So please be sure to chat with us and let us know your questions. Liver is huge. It has over 500 functions in the body. So, so many things can contribute to elevated liver enzymes. So, Nathalie, so good to have you here. Tell us your personal story about Jagger and what you did.
Yeah, absolutely. Thank you for having me. It's my pleasure to be here with you. So how the liver organ became one of my favorites to focus on and make sure I try to get a small grasp of what the organ can do and also the vital role that it plays in the health of us and our animals. So you mentioned it. The liver has so many different functions, but it is involved in everything that we do, especially when we think about anything that we put in our pet's body. It touches, right? And so my story began it was a routine annual blood test that I took my senior dog Jagger in. And matter of fact, I took all three of my dogs in for their annual blood work, and I was waiting for the results, excited to see them come back, wasn't concerned there was no health issues or any of the animals feeling off, and all three of their enzyme levels came back high. And although the other two, they're litter mates, so 5 years old, their ALT and their AST were slightly elevated above the average range. But most concerning was Jagger's, where his ALT was high, but most importantly, his ALP value, instead of it being around the 200, the mid 200 range, his was 3,100, and which is crazy high. And but he was acting normal, and he was acting fine, didn't show any signs. And so, hi Beth, good to see you on here. And so I was trying to figure out what could this possibly be. So not only did it catch me off guard, I was of course very concerned, especially with this really high elevated number, but wondering what could this be. So of course my mind starts to race. And
I want you to tell them though. So this happened while she was in the course, and she was like, oh my gosh, I thought my numbers were going to come back great because she'd been doing all of this protocol and all of this great stuff. And we were like, oh no.
And I was like, oh no, now where am I going to go with this? Right. In the sense of, I was excited to share with my vet what I've been doing. And her first natural response is, are you giving him mushrooms? And yeah, I was giving him mushrooms, but I also knew from this program, there's so many other things that, hi, Audrey. There's so many other things that could play into these elevated liver enzymes, especially knowing that the other two had slightly elevated enzyme levels too. So it was a process that, for me, in what was going to happen next, to not only segment one dog away from the other two, because we know when we're looking at something like this, it's individual to the individual animal. And so that's when the brainstorming started coming into play. And Delora, obviously you were a big part of this brainstorming process, but when I look back at what specifically I knew to focus on, one, I knew I was at the time, I already transitioned them over to the crock pet. So they had been on the crock pet for about 4 months, 4 or 5 months ish. So I knew that they were.
Hang on, just for people that don't know what the crock pet diet is, it's the diet that was formulated by Dr. Roberts, and it is 100% nutritionally complete for all life stages, and exceeds AFCO standards. So we know, and she's used it in her practice for decades. So we know this is the foundation of health. So continue.
Yeah, no, I'm glad that you shared that. So I knew he was getting the best possible food that he could get to help feed his body. And so I wasn't concerned, if there was anything that I was feeding him that was, that was insulting his liver. Then I was already giving him supplements, the total holistic body support. So I felt confident that, with that particular product, I didn't have to really look at the quality, but everything else I was questioning. Could it be the essential oils? Could it be the supplements? He tore his cruciate ligament 5 years prior. So he was on essential oils. He was on a couple other supplements that were to help support his joints, especially as a senior dog. So it was, based on what my vet was recommending, and we'll talk about that in just a second, I knew that there's a lot of things that I needed to do to help support his liver, because at that particular stage, anything that we could do to help take the pressure off of what the liver was trying to do and clean the body out, that's what was going to help. So when my vet came back with the levels, her first response was, "Are you giving him mushrooms?" And I said, "Yes, I am." And I was confident in the quality of mushrooms. And he was on CBD Dog Health, Myco Dog, Breathe. And I was confident that that was helping, because when he would run around, he would cough, and I noticed that he wasn't coughing as much. So I was a little put off by that was her explanation, right, for that. And I said, okay, well, I'm confident that what I'm doing right now, in slowing down all the supplements and getting back to the basics, is going to help us get more answers. And her response kept saying, well, it's Cushing's. And talking with many other professionals, in our group, we know Cushing's, and Dr. Ruth has shared this, Cushing's comes up a lot with elevated liver enzymes, right? And so, at that particular time, I had the support of you all to be able to go back and ask for additional tests. So we did a lepto test to make sure that there wasn't any additional bacteria or viruses that were going on in his body. And the reason why we looked beyond the liver is because when you look at ALP, there's several enzymes that are associated with liver health, but ALP and GGT values are things that are going on outside of the liver. In ALT and AST are actually the enzymes within the liver. So that's where we could start to say, are there things going on outside of the liver that the liver is still being irritated with, that's trying to flush out those toxins? So that was my first start. And we had many vet appointments after that, but yeah, this is why this is so personal to me. I will share, after 7 weeks of just focusing on the core food, and of course vitamins, and reducing the inflammation through omega-3s, we were able to go from a 3,100 value for his ALP down to 540, which is amazing in 7 weeks.
7 weeks. And did he show any symptoms?
He didn't. Not at the time. When I look back and I see how he's acting now, he actually has more energy than what he did at that particular point. And as a pet parent, we know our animals when their personality changes, or they don't want to eat, right? Yeah, I mean, those are easy signs to pick up on. But when we have a senior dog over time that maybe starts to slow down, he was sleeping a little bit more. Anytime, we would go for walks, or we would, go to the park, he was always ready to go. didn't think much about it. And so when I started to focus really on healing the liver and getting the sludge out, right, and starting to focus on how to support the detoxification of his body, I started to see that he had even more energy than, and so that made me realize, yes, he was actually showing signs and symptoms, but I just wasn't looking for those smaller signs that something was a little off. But this goes back to the value of routine annual blood work, and especially for senior animals, right? Because if I would have waited, who knows what would have had to have happened for me to realize that his liver, was really irritated, and in some ways, I would say being damaged, because when those elevated enzymes happen, it's 65% or more of the liver that's irritated or ultimately, being insulted. So I'm thankful that I went. And along the way, I was doing unique protocols for the girls and was able to get the girls are back down into normal range. So again, it's identifying and treating them as different animals, because Jagger's levels were slightly different than the girls, which made me realize that he does have a different tolerance of toxicity and what his body can handle than theirs.
Awesome. That's what a great story. I mean, you are perfect to talk about elevated liver enzymes. And we have a question if this video is going to be recorded, and yes, it is. And so you'll be able to listen to Nathalie's story and her recommendations for a long time. So Stavia wants to know, tell us what you did to help him.
Absolutely. So, as I mentioned, I made sure that he was on the original crock-pot diet. I reviewed, is he on the right diet? Because there is flexibility within this diet, based on diagnosis and what the animal can tolerate. I'm thankful that I already had done a Glacier Peaks prior to this blood work. So I knew.
Hang on just a sec. So for those of you who don't know, there is a sensitivity test called Glacier Peaks Wellness Scan, and it's available on Dr. Ruth's site. And basically, it's not an allergy test; it's a sensitivity test. So it indicates the foods and environmental issues that your pet may be sensitive to. And what that does, when you remove those elements, that allows the immune system to calm down. So when you've got a calmer immune system, that means their healing can take place in other parts of the body. So keep going.
So I had the results from the sensitivity test. So I knew that I could focus on the foods that weren't going to add more inflammation into his body, because that's a huge part of helping support the liver, reduce the inflammation, help support the gut and the microbiome. And then what I focused on is making sure that he had tools that were going to help clean out the toxins in his body. And again, remember, the ALT within the liver was high, but the extremely high value was actually outside of the liver. So I put him on milk thistle, and I also added liposomal glutathione. Glutathione is actually already in the body that helps, think of it as an super powered antioxidant that naturally cleans out the liver. So I put him on liposomal glutathione. That's a mouthful. And then the last additive that I gave him was a binder. And the binder that I ended up using, it's through standard process. But the key to the binder for me was making sure that as we're pulling out the toxins, not only in the liver, but outside of the liver, we could get it quickly out of his body. And that's what was one identifier that I didn't know before going through the program, how critical binders are. And then because I already had vegetables in the crock-pot, the original crock-pot diet that I was feeding him, I knew that was going to help, that fiber was going to help move things out faster as well.
Perfect. And Dr. Ruth likes to call that push and shove. So you've got you've got these liposomal glutathione, blah, blah, working its magic, but if there's nothing to shove it out, then it's just going to keep circulating. The liver is so efficient in its job that that's how some things gets caught in the phase 1 and phase 2 detoxification. So in order to get the sludge out, you've got to use a binder, such as, what are the binders that you recommend, Nathalie?
So there are a couple binders, and one specifically is GI Absorb. That's the standard process binder that I used. You can use activated charcoal. I decided not to use activated charcoal specifically on Jagger because GI Absorb is a little bit more forgiving on how we use it. And what I mean by that is you want to be aware of when you're using a binder, because if the animal is on any medications, then you want to make sure that it's not going to suck up that medication that the body needs. So for me, GI Absorb fit for what I was looking for, and you want to give it 2 hours before feeding or 2 hours, or at least 2 hours after feeding. So it's not absorbing the good nutrients and taking that out with it. So for me, GI Absorb was mine. We also have one, I'm blanking on the name. I'll think of it in a second. That's available to us. It's a new one. I haven't used it yet. Delora, do you know?
Is it the Cell Core product?
Yeah, that's the Cell Core product. And what's unique about that? I'm still learning more about it. I haven't personally used it, but but that may be an opportunity for us to learn a little bit more, because from what I've read and research is that we can actually use that binder with food. And so more to come on that in the near future, because I personally used it. But there are several different binders out there, and standard process I personally use standard process products myself. So I was confident in how clean that product is to be able to use for Jagger. And I also used it for my other two that were on the liposomal glutathione too.
Cool. Cool. So what are you doing anything differently now? Oh, yeah. Audrey. Thank you, Audrey. She always saves me.
Yes.
Carboxy.
Yeah. Thank you. Appreciate it, Audrey. So what took place from that? So as my vet was recommending I go through the Cushing's protocol, I respectfully push back on her on more tests, because with some of the protocols that she was recommending, it's not a conclusive protocol. And he didn't show any signs of Cushing's. And that's not the only reason, but I felt there was more that I could do for him instead of just settling on a potential Cushing's diagnosis, when I know that that's so very common. And at the same time, I had one of my close friends' senior dog went in, same vet, different vet at the actual office, but the dog had elevated liver enzymes at 500 for ALP. And again, he got the diagnosis of Cushing's too. So to me, it threw that, okay, well, you have one at 3,000 and then you have another one at 500, and yet we're looking at potentially the same diagnosis. And that just didn't fit. Right, along with it not fitting how he was feeling and the signs that he was showing. So with your support and Dr. Ruth, we pursued the path of doing an abdominal ultrasound. We wanted to see, was there gallbladder sludge, right? Because that can affect ALP values and ALT and liver enzymes as a whole. And we wanted to see if there's anything else in there that we need to know that could really be affecting these very high liver enzymes. So I went through that process. I did get a diagnosis. I was not hoping to hear that there was a small mass on his liver, less than a centimeter. And then there is a mass on his spleen, small. The spleen mass, they said they were pretty confident it was benign. But the small liver mass was something that I wanted to pursue and see, could this be the reason for his elevated numbers? And along the way, I put into play my plan to help support his liver and see if we could get those those levels down naturally. And my vet was following up with me asking, can we put him on Denamarin? And nope, I knew I wanted to go natural. And so 2 weeks later, after I did the ultrasound, we redid the blood work, and it came down to a little over 1,000. So I went from 3,100 down to 1,200. And so I knew I was moving in the right direction. And so the plan I put in place for him, I was on the right track. And so therefore I knew I was not going to continue to evaluate Cushing's. I wasn't going to look at Denamarin, right? So as we went into the next couple of weeks, I also connected with a cancer specialist in the area to see what does it look like potentially to remove that mass or to biopsy it to see what we're working with. That's when it was updated that it was only 1 centimeter. And she did say, listen, this being less than 1 centimeter, this doesn't make sense for the elevated enzymes, which that's when we started brainstorming, what could it actually be? And that's when understanding food that he was on, what we were doing to reduce the inflammation to help support his gut. That was something that we said, we feel good about what is going in his body. Okay, what could be outside that's influencing it? And CBD, surely, yes, CBD oil actually was something that Jagger was on, so I removed that from him. He had been on CBD for over a year, and most often we see with using CBD that the liver enzyme values will jump up a little bit, and then they start to level out once they're on it for a bit. So I wasn't as concerned with CBD being it, but I did pull that out of the protocol that I put into place for him. And then what I ultimately did was, let's just focus on healing the liver before we focus on the cancer piece of it. Because if I can help support the liver detoxification, then we'll manage the small piece of cancer along the way. And that's where I'm at in the process right now.
Awesome. So out of all of this, what do you think is a takeaway for yourself and pet parents that are listening today? We've got a lot of questions that we can get to as well, which I'm really excited about. But I think Nathalie had some real zingers after this experience.
So first, I would say respectfully push back on your vet.
Respectfully, yes.
Yeah, respectfully. And when I asked her about if there's false positives on Cushing's, she was hesitant to tell me. And I said, well, can we do a urine to creatinine ratio? I said, let's do that test to see if there's protein in his urine and see how everything looks in that, on that urinalysis, because we didn't do one. And then I also wanted to know kidney function, because understanding that the liver plays such a vital role in helping support the kidney function too. I wanted to understand what that all looked like. So of course the blood panel gave me some of that information, but I wanted a deeper dive into that. And it did give me some information, not to necessarily pursue Cushing's at that time. The other thing that I learned is have some urgency. I knew that at a value of 3,100, this is something serious. She wasn't giving me those symptoms. Matter of fact, when she said, well, we can do a ultrasound in a couple weeks, I'll have my travel vet give you a call when she's in the area. And I'm like, wow, like that just didn't make sense to me. So I got on the phone and started calling around, and luckily, I was able to find a pet ultrasound facility near me that I drove to, and I was able to get them in 2 days. There's a cancellation, and we were in, and I had the understanding of, are there masses? What can we be looking at instead of waiting 2 or 3 weeks and then having his liver still stressed? And then I would say the last thing is be mindful of all the things that are going into your pet and also the surroundings. So I was confident that his food and the supplements that I was putting in him were the best possible for him. But I also eliminated all the other supplements that he was on previously that may or may not be adding to the stress of his liver. So as I mentioned, you know, he was on joint support, he was on CBD, he was on mushrooms, and I will eventually start to add those back when we get his liver values back in range. But this is where we don't always know the quality of things. You know, he was on some essential oils. We don't always know when things could potentially change. But most importantly, for me, it was the extra things I could do in my environment. So I had a mold test done to make sure that there wasn't anything that was affecting all of my animals, because all 3 dogs, their levels elevated, right? And then we were doing a lot of walks outside and I live in Michigan, so a lot of salt in this area, especially in January. And they will throw salt down, and Jagger likes to chew on his feet. I mean, when he gets bored, that's like his chew toy. And so so I was watching him one day, and I said, you know what? I have been neglecting washing them off, their feet off, coming back in from walks. So every time we go out, even right now when spring's here, you know, there's a lot of runoff. You know, people treated their lawns in the fall. And so it's those little extra things that I can be aware of, and just reinforce to pet parents that take a look at the environment. What are the cleaning supplies that you're using? What kind of detergent are you using it to, you know, wash beds and clothes and that kind of stuff, and what we're putting on our floor, you know, vacuuming, all those things.
Right, right. And the liver does so much. It's easily burdened. I like to describe it as like a funnel. So it can only do so much, and it's taking in all of this stuff. And so when the funnel gets too big or gets too full, then the toxins start spilling over the outside, and that's when you see symptoms. We've got some questions that we can get to right now, but then we also have some, Nathalie's prepared some great questions for us that might be helpful. Like, what does the liver do? Symptoms of elevated liver enzymes. Let's do that before we get into the questions, because I feel like that this is going to be real helpful to address some of these questions. But I'm switching back and forth now, because this is a really great comment here. Raw Paw Adventures says that her biggest concern is cancer, and to look at some other things, thyroid, lipase. It's definitely helpful to do all the tests. And when Nathalie was talking about the sensitivities, like the salt and food, again, this is where the Glacier Peaks Wellness Scan is going to help you figure those things out. So tell us, what does the liver do, Nathalie?
Well, a couple different things, but I'm going to keep it high level. Liver is responsible for blood clotting. It's responsible for clearing out the toxins, and in some cases creating or manipulating the toxins. That sounds like a negative word, but I'm going to use that for now. It's adjusting the toxins to be usable, to be able to be used by the body. So the liver is quite busy when you think about what it can do. Like when we think of medications, prescription meds, it adjusts those meds to be able to have the body absorb it and use it. The same with whether you're using essential oils or any plant-based medicine, it actually adjusts that for the body to be able to absorb it. So it also works very closely with the gallbladder, right? Being able to process fats. And then I would say most importantly, when we think of the liver, it is taking the good substance, the blood nutrients from the stomach and the intestines, and actually converting it into something that the body can use.
It's my favorite organ. Hopefully all of you people that are joining us today are like, I can understand that. I can't say that to my other friends because they're like, oh my gosh, you're weird.
I mean, it really is in everything that we do in our animals. It's I don't know. I'm not going to say it's the best organ or but it's one of the busiest, right?
It's one of the busiest for sure.
One of the busiest. And when we see the liver off, balance, and it affects the system, the whole system, right? And so that's why it was so alarming to me that my vet took a little slower approach than what I was comfortable with in moving forward. And along the way, I could do the things that I needed to do to see if I could naturally get those values down, but get more tests. And I didn't mention this, but I think this is a good place. There may be a certain point in time that you feel you outgrow your vet.
That's hilarious.
And yes, I like that. I call the liver the general. Yes, that's definitely so in this case. But I did outgrow my vet, especially for this particular animal. So now I go to an internist that is more familiar with the internal makings of what the body's responsibility is to do, and looking at it more from a holistic standpoint, and also has the tools in-house to not only run blood tests same day, has a surgical team. So something to keep in mind that I never really thought of, even though I have a great relationship with my vet. Sometimes it serves you and your animal to look outside of that, and so you might be able to help and support a little bit more.
Okay. So what are the symptoms of elevated liver enzymes?
Well, in some cases, you're not going to necessarily see them. So that's why, again, I'm going to push and advocate for annual blood tests, and for some animals, maybe you do it every 6 months or every 3 or 4 months. So you're going to typically see weight loss. In some cases, you might even see weight gain, depending on hypo or hyperthyroidism, loss of appetite, vomiting, diarrhea, increased thirst and urination. Sometimes you might even see jaundice, right? Depending on what's going on with the animal. And then ultimately you may even see some fluid buildup, on extremities. So those are, I would say, the most common. Dry skin, skin issues, but anything that pretty much, I would say, majority of the symptoms that you may see in an animal that doesn't seem right, you could probably associate some type of, liver challenges going on.
Okay. What conditions typically affect the liver? Because you talked about Cushing's earlier, you talked about lepto. Are there any more that folks can think about whenever they're brainstorming on why their pets' enzymes are elevated?
Yeah, unfortunately, we do see cancer, right? Cancer, with many different types of cancers, especially when I was thinking of ALP, high ALP, and that being outside of the liver. I was thinking that could be bone. Sometimes we'll see puppies that have higher ALP values because they're building bone, right? So don't be alarmed if you see that for any animals that are growing. We can see toxicity from metals, biliary disease, and I would say medication side effects. If they're overdosed with medication, yeah, muscle weakness and muscle loss, you could definitely see that. Absolutely.
Awesome. So you were throwing around some acronyms earlier. ALP, GGT, ALT. For those of us joining today that aren't real familiar with those acronyms, can you tell us a little bit more about what those mean?
Those are enzymes that are actually, I'll keep it high level, but that's what we're here for, to help educate, right? Yeah. Because you can find that you're going down or a big rabbit hole, looking at information. And I was guilty of that, trying to figure out what could be causing ALP. It did give me some peace of mind knowing that I was doing the research. And of course I had access to the best of the best in this community. But they're enzymes that the liver creates to give notification when the liver is stressed. And so, as I mentioned earlier, that the body will produce a higher level of certain enzymes, ALP, GGT, ALT, or AST, depending on what's going on, what's getting stressed, whether it's inside the liver or outside the liver. And that tells the body that, hey, we need to give a little bit more support to the liver, because the liver is working overtime to help take care of the body.
Awesome. You have definitely done your homework. So for those of you who are with us today, We are holistic pet health coaches, and this is what Dr. Ruth has trained us to look for, to research, to help pet parents with. There are 50 graduates, probably 51 now. We all know the ins and outs of this stuff, and we work in conjunction with your veterinarian's diagnosis, because we cannot treat, diagnose, or prescribe. But what we do is work in the background to help support your pet's health overall. And each pet is individual. So you need that one person to help you look over all of these details and help you get into a protocol specific for your pet. Natalie had the benefit of having a huge support group and all of the knowledge that Dr. Ruth has given her to help Jagger bring down his liver enzymes amazingly. Tell me give me the overview. What was it and what is it now?
He was at 3185 for his ALP, and as of 3 weeks ago, he's at 542. And his ALT was 557, and now it's in normal range, which is 115, and his AST is in normal range. So again, what I'm focusing on, ALP outside of the liver, to continue to bring those down.
So we've got some questions. Scott says, my vet tells me my senior dog hind end muscle loss and weakness is age related. I respectfully disagree.
There's a reason why something's going on there.
Yes. So Scott, I think I saw where you might be working with Amanda Rimenschneider, and that is perfect for her to be able to investigate what's going on. There's actually in traditional Chinese veterinary medicine protocols that address hind end weakness specifically. So there are many things that can be done, but because every pet is individual, we need to know the ins and outs before we can give any solid recommendations. So this was fascinating. Thank you so much, Natalie. We've got a whole lot of questions. Let's see. Scrolling back earlier, let's see. My dog has elevated liver enzymes. Did ultrasound and showed gallbladder is full of sludge. Any suggestions on how to clear this up? I have some. What about you, Natalie?
Yes. I will say my dog was actually put on ursodiol by the recent vet to help support the gallbladder. There are a couple others out there that are more natural through standard process. But my first thought would be, without knowing anything else and seeing the actual values itself, I would start with milk thistle. And then I personally, before recommending something like liposomal glutathione or even a binder, I would like to see those results for a more specific plan of action, because there's different ways that we can go about that. And then let's throw in, sorry, I might be cutting you off here, but most importantly, I would say, let's look at the diet first and foremost. Food heals. I am a big fan of even creating food that's supporting that organ system. So I didn't touch on that because that can get a little overwhelming, but being able to feed leafy greens and dandelions, and being able to get into ginger and mustard seed, those all support liver. So that would be something that I would make sure that we would add into to help support your dog.
Kim, the only thing that I would throw in, Natalie really covered this well, is bile salts. Bile salts come in digestive enzymes that will help break down that sludge. Okay, let's see. Edie, she had normal labs on February 2nd. The vet gave her first and only Librela shot on February 25th, and her liver enzymes were elevated 3 weeks later. So Natalie was talking about earlier, the liver has to process everything. And this is probably why the enzymes were elevated. What I would suggest, some vets give Denamarin, which there is a better solution that Dr. Ruth recommends, which is milk thistle. Natural, completely natural, and she has seen some pets really do better on milk thistle than the prescription drugs. So you might consider that. Would you have any suggestions, Nathalie?
No, I would say one, if you have previous vet records of labs, what is the normal for that dog, right? I think that's a big focus that I took away from Dr. Roberts' training, is understanding what the normal is for an animal that is feeling healthy, because they might be normally high in the set range, right? Considering that shot was given after the labs were done, if I'm reading this correctly. Okay, what did the labs show on the second? So if the labs were high on the second, it probably had nothing to do with the shot, but when was the shot previously, right? So I'm trying to figure out, what's the history of that animal? And then I do 100% agree, milk thistle. I'm a big fan of the focus product in milk thistle is Silymarin. And you just want to make sure that when you're looking for a milk thistle product, because they're all over the market, is just make sure that you're not getting a lot of other additives in that product. Silymarin is the key to that product that's going to help support the liver.
Love it. Love it. You're awesome at this. Thank you. You're making me look good.
Good. I'm here for it.
Another question. Have you worked with Sam E?
I have not.
I haven't either. It's worth some investigation. Our livers are so forgiving. They can grow themselves back. So I think any relief that you give it, as far as, relieving toxins, relieving sensitivities, it's going to get better. So this is just another avenue. So I would look into it, Evelyn, for sure. Let's see. We talked about the name of your binder. We talked about CBD oil. Amanda wants to know, how soon did you retest the blood work again after implementing your protocol?
Yes. Miss Amanda was one of the coaches that I've worked so closely with, and we will actually be on next week together. So yes, you will see us in action. But Amanda, you know me well enough that I am not necessarily a patient person when it comes to getting information. So I actually waited. I was looking at between 2 to 3 weeks to get the blood work done, because I wanted to know, was there any room for improvement on what I was doing, taking off the supplements, focusing on the environment, cleaning the feet, and everything that I was doing in addition to the food, inflammation, and holistic total body support for the vitamins. So I wanted to see if I could make any adjustments while I was already getting information on the ultrascan. So that's why I was a little bit more aggressive with getting the blood work done. Typically, I would say, 4 weeks when, at the most, with an elevation this high. Because for me, if I couldn't see the liver enzymes decreasing, then I had to do something to help take the stress off his liver, whether that potentially be, testing for Cushing's or Denamarin or whatever approach it was, working with Dr. Roberts and my local vet. I just needed to make that improvement happen sooner rather than later, rather than wait 3 months. So in certain cases, I do think 3 months makes sense. Once I can get his liver enzyme values back into what his new normal range is, then I will look at that being every couple months. And then I can start moving that out, as long as we're seeing consistency in that range.
Awesome. Yeah. Regular blood work. That is the key. So speaking of Amanda, she's been working with Joanne, and Joanne's been doing the crock pet diet for a year. Yay, that's a big deal. I really love seeing this because cooking for your pet or even feeding them raw is a huge mental leap for us humans. It is the number one thing that you can do to improve your pet's health, but it is also the number one hardest thing for us to put into our schedule each day. Promise you it's worth it, because we have so many people that are saying fresh food works, and it does. I'm here to say it works, because I'm, autoimmune sufferer, and I control my symptoms with fresh food for sure. But anyway, this isn't about me. This is about pets. The question is, of kelp came up through all this. Can too much affect the liver? So too much of anything pretty much can affect the liver. Yeah. Whenever you're using the crock pet diet, and it does call for kelp, that's for iodine. And the amount is like this big, 3 scoops of tiny little teaspoons. And if you do too much, like a tablespoon, that is too much iodine. So you're going to get some symptoms, lethargy, diarrhea. What are some of the other ones?
Maybe vomiting.
Yeah, vomiting.
Yeah. Well, and I would say, depending on where an animal has a bucket. So we all have a bucket, right? In the stress in what that bucket already has in it. If the bucket's higher, then with all the things that the liver is doing to take out of the body, then you may see more symptoms, than what an other animal might be able to handle, just processing out the extra iodine. So I'm glad that you pointed that out, because you're right. That amount, the little spoon that comes with the kelp that we recommend, typically the Now brand. I mean, yeah, it's like the size of a pencil head, right? You just scoop and you're like, oh, I think I got a granule of kelp. But yes, be careful with that, because that can definitely increase liver enzymes.
Let's see. Karen, who is one of our health coaches, she had a senior pit bull with 3 times the high end for liver values on his lab work, then got them back to normal. Oh my gosh, by switching from kibble to cooked food.
No surprise.
Yep. Awesome. Awesome, Karen. That's fantastic. Let's see. Leslie, let's see what she has to say. This 4 months ago, and I have him on a natural compound in cortisone in order to keep his glucose stable and prevent him. This is a long one. Can't give him dandelion because it drops glucose. So is there anything else besides the milk thistle that I can use to support his liver health? He's raw fed, no other meds or conventional treatments. Leslie, you need a holistic pet health coach. Yeah. There's so many factors that we need to know before we can do a recommendation. We need to know what his food is. We need to know what his environmental things are. So we have had some of our coaches and are obviously super duper into this, and they're doing everything right. One of our coaches, Wilma, she's one of our original graduates. She was doing everything right. And then it hit her one day that her pup had a very favorite blanket, and she would just roll and love in that blanket. And Wilma thought, I wonder if it's that blanket that's giving her elevated liver enzymes. Sadly took away her favorite blanket, and her liver enzymes went down. Wow. So yeah. So you've got to be observant of everything as far as the liver goes.
And I will say, and I'm going to reinforce this, I was fortunate in the sense that when I was going through what steps I need to take, I could rule out food and environmental, toxicity, because I had done a lot of these other things beforehand. So I do encourage any pet parents that are on the fence to if they're not sure if they want to switch yet, make the jump. If you're not sure, if your what you're using for detergent or cleaning supplies is affecting your animals, make the switch, because to be able to rule those things out, I know had a huge benefit of what I could do and what I could focus on to get the results that I got in such a short period of time.
Good going, Audrey. Cooking for your pet is the number one thing.
I was going to say, Audrey's also a partner in crime and doing some brainstorming as she's working with her dog, Carter, on getting those liver enzymes down too. So having the community and leveraging the community is very helpful.
Yes. Yeah. She's a coach as well. Just graduated. So congratulations, Audrey. So Joanne is saying that his ALP went up to 2,000. What's Danzatron? I've never experienced that one. And ursodiol and a low fat kibble, which I hate. I get it. What is the blood test called that she needs to follow up besides a full chemistry test?
Did you, when you got the blood test that you received gave you the ALP, the ALT, AST, right? I assume, because it's the chemistry panel. What I mean, this is a hard one, because I would love to see what the other numbers are. To me, when I see ALP tends to rise after ALT and AST. So those happen, you know, if it's more acute, short term, and then ALP will rise after. So I'm curious, if ALT and AST are down, is the liver already in the process of cleaning stuff out? So I think we need a little bit more information on that. And then, of course, I would be saying, let's dig in on what the kibble is. And again, I'm going to focus on food, because when we feed fresh food, we can add in the brassicas or cruciferous vegetables, and that's a huge supporter of liver.
It
liver
is
detoxification naturally.
And in fact, Elizabeth chimed in and says, broccoli sprouts are the most potent phase 2 liver detoxifier known. I grow them around the clock in a mason jar and screen lid with no dirt. I didn't know you could do that. That's really cool. And she says, freezing and chopping the broccoli sprouts increases the potency. I freeze mine for sure. Also high in sulforaphane, which is anti-cancer. Yes, sulforaphane is, I've read studies where it is actually more potent anti-cancer than the anti-cancer medications from broccoli sprouts. Those little tiny little things that you get in the store is so potently good for you. So go get you some broccoli sprouts. Let's see. Scott says, my dog's ammonia in the blood is very high. Did your vet check your dog's ammonia in the blood?
Yes. All ammonia. This is where we're looking at the bun too, the bun ratio, to make sure that we can clear that out. And that's going to be looking at kidney values too. So, yes, I would definitely, Scott, ammonia is tough because it could be kidney or it could be liver, right? But they do link together.
Cool. So because we were talking about environmental toxins, Stathia wants to know, what do you use for detergent? What do you use?
Me personally?
Yeah.
I actually make my own. And the reason why I make my own is because of this specific. I had a dog, my previous dog had high liver enzymes, and that's how I found that he had lung cancer. So as we were going to, and he was very, very sensitive to smells and especially detergent. So I make my own specifically with borax, I mean, basically lately I've been focusing on essential oils, and I'm blanking on the main ingredient. Give me a second. I'll think. I said borax, and then yeah, give me a second.
Okay. All right. Well, I'll tell you what I do. I use a brand called Molly's, and there are some brands out there like I probably shouldn't mention these, but they're what they call greenwashed. So what you have to do, I mean, even though their label looks, oh yeah, that looks holistic, you got to turn around and, or at least do your research before you go to the store. So I've researched, and Molly's is a good clean brand, but I make my own dryer. I used to love the dryer sheets. They made everything smell so nice. But those are the worst. And those plugins, those are terrible. Anything that comes through the nostrils don't get the benefit of going through your liver. They go straight into your bloodstream. So those, anything that has a really strong smell, that's not natural. Those are nanomolecules that are getting into your bloodstream. So you need to be careful. All that to say, I make my own dryer sheets. I take old t-shirts and I cut them apart into some, nice big squares. And I put them in a jar with distilled water, a dash of vinegar, and some essential oils. And that makes the laundry smell nice. And, but you got to pull it out before it gets, bone dry, or you're still going to have some static there, but it works pretty good, along with the little, the lamb dryer balls. Those are fun too.
I'm going to jump in. Definitely baking soda. That was the B word that I was looking for. Baking soda. Yeah, that works. That's what I moved away from, right? But yeah, no, baking soda is my go-to, and I put essential oils in it. And that's also a secret sauce for kitty litter too. You can put a little baking soda in the kitty litter and move it, fluff it up and move it around, and it helps with, making it smell a little bit nicer.
Nice. Oh, and we have Bronwyn joining us today, who is a holistic pet health coach and specializes in cancer. And we're glad to have her join us and have a comment. Microgreens are 4 to 40 times more potent than Sprout Center than their adult counterparts. Oh, that's good to know. I eat microgreens every single day. Let's see, Scott, and we're getting really close. We have so many more questions, but we're getting close to our hour. Scott says, dog's ALP was in the 2000s for a few years. Everything normal. He's 13. Did all the tests and nothing abnormal. So, it might have been the situation that he was in for a little while. And if he showed no symptoms and everything was fine, you just keep going. It's, every pet is different. Every owner is different. So you use your gut a lot as a pet parent. Just like kids, you don't get instruction manuals. So, do follow your gut, and you will always do right by your pet. Let's see. Oh, and Brahman also says, beware of broccoli issues with hypothyroidism. I have hypothyroidism, and that's more for the raw vegetables that have the problems that conflict with your thyroid. So if you cook them good, you should be okay. Leslie says, I only use vinegar only for detergent. Works great. Okay, love that. Oh, and
I'm cleaning my house. That's my go-to. So
yeah, me too. Me too. The floors, I mop my floor with vinegar. My house kind of smells like pickles when I'm done, but it's okay.
Not bad if you like pickles, but you can put a little essential oils in it. My favorite is lemon, lime, and orange. Sometimes I'll throw some peppermint in there too.
And Audrey likes Castile soap. Everybody has their secrets. Love sharing the secrets here. Let's see. Lisa is another pet coach. Hi, everybody. I use vinegar as a softener. No sheets in the dryer. Yeah, that's amazing. That's wonderful. Let's see. Nature's Clean. This is from the Wally Foundation. Is a great brand for cleaning products. Oh, okay, I'll have to check that out. Let's see, Elizabeth. I mean, I love that everybody's all on the same page here. All synthetic scents are severe hormone disruptors. Yep. Love the t-shirt thing. Thanks, guys. Thank you. I'm so glad that you have joined us today. We're going to have to wrap it up. We've got a few more questions. So sorry that we didn't get to it, but I'm thrilled that you guys were so engaged today and had lots of questions for us. And if you have conditions that weren't answered here that you need to address, focus on your pet, please hire or consider a consultation with a holistic pet health coach. You can go to drruthroberts.com and click find a coach, and then scroll down. You'll find my picture, you'll find Nathalie's picture, you'll find all of our coaches who have graduated on that page. And every single one of us will do our best. I'm going to plug here that whenever when you partner with a holistic pet health coach, they will stick with you. They will research, spend more time than you realize to research your pet's health issues. We are, I hate to say it, but rabid, pun intended, pet lovers, and we will sacrifice our time and energy just to make one pet feel better. So whatever the charge is for that pet coach's time, it is so worth the benefits that you will get from your pet's health going forward, because these are all things actionable things that you can do at home and that can help your pet feel better, have lots more loving times with them. So with that, thank you guys so much for joining us. I hate to leave just because there's so many people here, but thank you so much and have a great day. And Nathalie and Amanda Riemenschneider will be with you next week, because Dr. Ruth and I will be at a trade show in Austin, Texas called Disrupt Clinical. And I'm going to talk about that a little more. So Disrupt Clinical is a bunch of healthcare providers that are doing things beyond the typical healthcare standard of care. They are doctors and chiropractors and acupuncturists, and just a community that is devoted to healthcare, us taking our own power back. So we're super excited to be there, because I feel like that it's a wonderful audience, because we're taking back the healthcare for our pets. So stay tuned and you'll find out more information about all that. Thanks, you guys, and have a great week.
Thanks.